Hi everyone, I'm Bridget Parsons, Market Access Manager at Diasorin, and today I'm excited to talk to you about flexible respiratory testing and the potential clinical and economic impacts of a flexible model. We'll start by looking at what makes liaison-plex RSP different from traditional syndromic testing. Then I'll share some real-world examples from academic medical centers, a community hospital, and a commercial lab to show how flex testing can be used in any setting. Traditional syndromic panels are fixed tests looking for every target every time, but what we know is this is not clinically necessary for most patients and it's economically unsustainable. Flex software allows labs to customize panels based on specific patient needs and care settings to provide relevant results while still aligning with reimbursement policies. Historically, labs have had to choose between getting answers or getting paid. Syndromic testing has been an all-or-nothing approach, and what we have seen is the covered landscape for large syndromic respiratory panels has become more and more limited to the point where it's really become an inpatient-only test. For example, when you look at Medicare Part B data from 2021 to 2023, you can see that the two CPT codes, 87632 and 87633, for the larger respiratory panels have a nearly 100% denial rate across all 3 years, compared to around just 20% for the small panel code 87631. Flex testing allows labs to create custom panels that can be billed using CPT codes that are covered and are more likely to be paid for. Flex testing is built around the principle of precision medicine. Labs can tailor panels to get results relevant and appropriate for the patient and the setting. And the difference between Plex and other so-called flexible panels is that with Plex you only pay for the targets you choose. We don't just give you fewer results for the same price. One of the biggest pain points for lab professionals is the time and complexity often involved in running large panels. With liaison-plex, we've streamlined that process. The platform is fully automated with minimal hands-on time and delivers accurate, targeted results that are directly relevant to the patient's symptoms. What makes flex testing so powerful can be summed up with this one word, adaptability. With one panel, labs can meet a wide range of clinical needs, whether it's a pediatric patient in the ED, an elderly patient in long-term care, or someone immunocompromised in the ICU. Flex allows you to tailor the test to the patient and reduce redundant testing using targeted, reimbursable diagnostics. Let's take a look at some real-world examples of how flexible testing can be implemented, and we'll start with two examples of academic medical centers who did a retrospective analysis of their data from 2024. What they found through assessing their target prevalence by month was that specific panels could be leveraged by season to capture the majority of their positive tests, so they could do most of their testing on a smaller, more economical panel while still having the option to unmask additional targets as needed. In our first example of 5,767 patients tested, 1,602 had a positive result. Using a prevalence-based testing model, 1,421 of those positives would have been captured in the initial panel of the top 7 most prevalent targets, with just 181 needing a subsequent test. Similarly, at the second institution, out of 2,292 tested patients and 462 positives, 428 of those were captured in the first panel, leaving only 34 patients who would have needed additional results unmasked. So during the fall and winter season, for example 1, the first test would have captured 89% of the positive tests, with 10% being captured in the first reflex and only 1% of patients needing a second reflex test. Similarly, for our second institution, 93% of positives would have been captured with the first test, with the remaining 7% being captured in the first reflex and only one patient requiring a full panel test. We see a similar story when we look at the other half of the year and the spring-summer panels. Out of 844 positives at the first institution, 796 of those would have had an answer just based off the initial panel. And at the other institution of 337 positives, 302 would have gotten a first test positive result. So for our first example, that would have represented a 94% first test capture. And for example 2, a 90% first test capture. These are two examples of how flex panels can allow labs to run smaller, more relevant panels and reflex only when needed to preserve diagnostic yield while reducing unnecessary testing. So what is the budget impact of this? By reducing their traditional syndromic panel use, our first academic center example could have saved over $300,000 annually, and the other could have saved more than $100,000. These savings could be reinvested into more efficient testing platforms, staffing, or other lab priorities. Next, we'll look at a community hospital example. Community hospitals face different challenges. They often depend more heavily on reimbursement from Medicare and Medicaid and operate on thinner margins. With Flex, one community hospital created multiple small panels tailored to patient location and acuity. They created 5 panels of 5 targets or fewer, a general outpatient panel, 2 ED panels, one for adults and one for pediatrics, a follow-up outpatient panel with expanded targets, and an atypical pneumonia panel with just bacterial targets. This hospital recognized that for most patients, a large multiplex panel first line is not necessary and can be saved for the patients who really need it. This strategy led to over $130,000 in annual savings without compromising care. Last, we'll talk about how commercial labs can benefit. Commercial labs are in a very challenging position because they rarely have any type of control over the test providers are ordering and have to do the work not knowing if they'll get paid. This commercial lab decided to offer a base panel and then build variable panels based on client needs. As a commercial lab, we don't have as much insight into their pricing and costs, but you can imagine instead of running a fixed large panel for every patient and rarely getting reimbursed for it, now they are able to only pay for the targets they run and frequently get reimbursed for their testing. So it's been extremely beneficial for them. Flex testing empowers labs to align diagnostics with prevalence, patient symptoms, and reimbursement. And because you're only testing for what's clinically relevant, you can optimize cost and coverage. It's a smarter, more sustainable approach to respiratory diagnostics. Thank you for your time today, and please reach out with any questions or to learn more about flexible testing with Liaison Flex.